Having talked with hundreds of parents about an ADHD diagnosis and the natural ways to help it, there's still a lot of confusion on if a child actually has ADHD. What are the causes and how can we help them without medicine? In this video, we're going to look at ADHD through a lens that's different than just a diagnosis, unpacking it to see the symptoms and then see how the brain and the nervous system influence these systems of the body that bring about attention, focus, and impulse control struggles. Going back to a main root cause will help truly make sense and find answers to address those difficulties within our kids. Parents, this is specifically for you. That you're looking for medication and drug-free options that you may have heard from a teacher, from a school administrator, or a counselor that medication is the only option or the best option for your child, but it's not congruent with your beliefs or what you want for them. Additionally, many dads and sometimes moms too attribute ADHD symptoms as genetic. Common thing that I hear is like, I struggle with these things, so it makes sense that my child did too. We're going to explore what ADHD really is, how to properly test for it, and most importantly, how to address the root causes of ADHD struggles. You're going to learn about our unique approach that goes beyond traditional diagnoses and medications, offering a path to turn ADHD into an absolute strength. Parents, let's look at some eye-opening stats. Recent data shows that ADHD affects about 6 million kids in the US. That's roughly about 9.4% of children. Even more striking, ADHD diagnoses have increased by about 42% between the years 2003 and 2011. Now, these numbers are massively staggering, but what's truly concerning is that many of these children are prescribed medications as a first-line treatment without exploring the root causes, why it's there, or what alternative approaches there are. The good news is that at Haven Family Chiropractic, we're seeing a growing trend of parents seeking more comprehensive, drug-free solutions for their child's ADHD symptoms. So let's start by understanding the types of ADHD. So first, it's crucial to understand that ADHD is not a one-size-fits-all. There are different types, including the combined type, which is the hyperactive impulsive, and the inattentive type. So each presents differently and requires a tailored and customizable approach. ADHD isn't just necessarily a busy and overwhelmed brain. The body can be overwhelming the brain too, so causing the entire nervous system to be in this fight or flight mode. The question that most parents have is, where does this stress from the body, primarily the internal environment, come from? The quick answer is from 4 key stressors that are often overlooked. The first stress being high-risk pregnancy or high-stress prenatal period, because this puts mom and baby into a sympathetic dominant state that shifts more of them into a fight or flight or protective state. The second being birth interventions like forceps and vacuums, C-sections, or even inductions, because this places a physical component of stress, most commonly within the upper neck, which overwhelms the neuromotor development. The third being fussy or colicky as an infant with reflux and constipation struggles that continue to overwhelm the automatic or autonomic side of our nervous system. And the fourth being frequent ear and respiratory infections before the age of 3, along with antibiotic usage, further adding stress to the autonomic nervous system and the vagus nerve by way of the brain to gut connection. So when our nervous system gets overtaxed and overworked with these 4 big stressors, the signals it sends to the brain are full-on protection, fight or flight responses in every area of the brain. So the cerebrum, which is like our motor centers, it causes kids to not be able to sit still. The midbrain or our limbic system, specifically one part called the hippocampus, it affects our focus, our attention, and plays a really big role with our emotions as well. And then the prefrontal cortex. So this region is what affects socialization and situational awareness and the ability to self-calm and regulate. ADHD isn't just hyperactivity. So an overwhelmed body and brain can cause brain fog and focus and attention issues. And if it's not addressed, this can be a huge energy drain for our kids. And this is actually quite common to see with ADHD, especially if they have struggles with all 4 causes above, to be more wound up and tired out instead of hyperactive. This happens for these main reasons. Because when the system is in sympathetic dominance for a long time, high energy, low sleep, constant stress, it eventually burns out and demotivates. Tiredness and grumpiness starts to set in. So let's chat about genetics. Yes, genetics can influence these behaviors, but not as nearly much as we think. Our nervous system, the vagus nerve, and its development play a much greater role. There have been studies by Dr. Bruce Lipton, who's a PhD biologist that also studies very heavily in epigenetics. It's estimated that no more than 15% of our genetic code determines our outcomes. This means that 85% of our genetics is up to us, and it's influenced by internal and external environmental factors. And this is incredibly encouraging because meaning that even if dad or mom may struggle with attention and focus and brain fog and low energy or ADHD type symptoms, it does not mean that their kids have to as well. So you're probably asking, what can we do to test for ADHD? With traditional ADHD testing, it's often focused solely on symptoms. So at Haven Family Chiropractic, we go deeper. The INSiGHT scanning technology we use in office allows us to measure the exact amount of distress, dysfunction, and disorganization within our central nervous system and the autonomic nervous system, because this gives us a clear picture of what's really going on within the brain and the body. For example, in a classic raging bull ADHD case, we might see a huge total energy index on our surface EMG scan when the optimal is 150 or less. Whereas like in inattentive drunken bull type, we might observe a pattern score of 50 when 100 is ideal. These metrics tell us more than a checklist of behaviors ever could. Parents, let's talk about addressing root causes. So instead of just addressing and trying to treat symptoms, we focus on the underlying neurological imbalances. ADHD often stems from an overstressed, stuck, and out of balance nervous system. So by addressing this root cause, we can create lasting change. What comes from there is utilizing personalized plans of care. So with the data that we collect from the INSiGHT scanning that we use in the office, we're able to create a customized, specifically tailored plan of care to exactly what your child needs. There is no one-size-fits-all plan. And while medication has its place, we believe in exploring drug-free options first, because our approach aims to optimize the brain function naturally, and then reducing or eliminating the need for medication in many cases. So most importantly, we help reframe ADHD, because it's not just a disorder, it's a different way of processing information that, when it's properly managed, can lead to incredible creativity, productivity, and success. Parents, if you're tired of feeling held back by ADHD, or if you're a parent watching your child struggle, it's time to take action. Don't let another day go by feeling overwhelmed or misunderstood. Check out our website or even give our office a call to schedule your child's neurological INSiGHT scans, because we want to work together to help you uncover the root causes of ADHD symptoms and create a personalized plan of care to be able to use ADHD as an absolute superpower.